Thank you. I am working for the Gender Center at the KILSH. So I'm the last one who speak in front of all of you, so I will be very precise. Well, from the first and the second presentation, for the first presentation, taking gender aspect, targeting adolescents and the young adults, that was quite impressive, in particular in the field of the occupational health, safety and health. Simply saying that we need to reduce the negligence to eliminate sudden accident, that kind of approach is not enough. And even that is more geared toward the male workers. So that is quite that is quite similar situation in Korea. And it's really important to expand the vision of the occupational safety and health, taking into the sex and gender. And for the second study, discover differences in the nature of safety and health problems that occur in workplaces where the women are the majority and where men are the majority. And the situation or the understanding of the Ministry of the Education is very different from what the teachers recognize and what the students recognize. The lack of the consideration of the gender in all these approaches are very similar in Korea. I am working at the hospital. I'm a doctor of the occupational and environmental medicine. And actually, the moderator for this session, Jiyoun Jung, I talked to her what we can do. I put up my question under the anonymous name, so she didn't recognize it was me. So I asked a question that what we do, what do we have to do in order to improve the health and occupational safety and health for women? And the answer from the Professor Jung was that we need to train people from the very beginning when they were young and when even in the childhood. And I think it's really necessary. So I believe that that is the issue or the topic that we need to discuss further. And also, in Korea, many adolescents suffer injuries and even death in the field vocational training site. So before they are going for the internship, there is some materials, training materials, which says you are the students, you're not the workers. So actually the internship is for the education or the training purpose. That is quite highlighted more recently in the training materials for the students in the vocational schools in Korea. So we need to understand how the training at the field need to be rolled out. And we also have the teachers at the work site. So those teachers train and teach the students about the safety issues. Then those teachers at work site, how are they selected? Of course, they should be certified. They need to get some training online or offline. But if the company does not have that kind of a qualification, then the company can actually select one of their employees to do that job. So I think it's an issue. We know that there are many accidents occurred, even death of the young people. So we need to do something. So we're now doing something, but in reality, there is not much of a significant improvement made. And as presenter shared, the training systems or the educational programs, the courses, that are also needed in Korea, not just the vocational training teachers, but also so-called teachers at the work site. They need to be trained too. Otherwise, the situation will not change at the workplace. So for me, I do have some questions to discuss to the first presentation team. So called the school teacher provision. is considered a central stakeholder in occupational safety and health obligations, then we'd like to understand more to what extent you can work with the companies to fix the specific risk conditions for the apprenticeship. For the second presentation, so the schools do have the vocational training courses for the vocational training teachers. So is it voluntary participation for the teachers to be in that course? And how do you enroll the students, so the teachers, the vocational teachers for those programs? For Messing, Dr. Messing, I live in Daegu, which is not the metropolitan city, but my city is actually shrinking. Then how do we know it? The number of the women of childbearing age is divided by the number of the population over 60s. So actually the city is shrinking in terms of the population. So the city government says that you need to get married more, you need to have more babies. But at the same time, many researchers also say that women are leaving the city, leaving the area because there are no good jobs for them. And for those remote areas, the local areas, the patriarchy culture is stronger than the metropolitan Seoul city. So actually, the lack of decent jobs and the strong cultural heritage of the patriarchism is not a good. So listening to the Dr. Messing's presentation, I strongly feel that we need to have a coalition of the researchers doing their research in the local areas. So I also appreciate Dr. Messing for presenting that vicious cycle diagram because it explains a lot. So I'm actually using that vicious cycle diagram in my practice and in my research a lot. So I have a question still. You said that there are still issues to be discussed in integrating the GBA in the process of creating regulations. So if you have any specific examples, then it would be good to hear them.